In this project titled Landscape of Circulating Tumor DNA Abnormalities in Advanced Prostate Cancer, Distinctions in African American versus Caucasian Patients, we got another way of collaborating with our colleagues to understand a little bit more about the potential clinical value of using liquid biopsy and whether or not we're seeing differences in terms of the molecular and genomic landscape in African American compared with Caucasians. So really this study included a real world cohort of 360 patients managed at different academic institutions within the country. For this work, we used a commercially available 74 gene panel, Guardant, and we went through and basically compared the results in terms of genomic data found in the liquid biopsy, and also try to understand a little bit more with the help from our statisticians, the potential differences among African American and Caucasians in this setting. So we basically took the first available liquid biopsy for all patients, African American, 81 patients, and then 280 Caucasians with metastatic prostate cancer. Although the final analysis included a subset of them, 138, which were really the patients who had available 74 gene panel results that, some of us know, updated the panel of genes to be tested here. We basically analyze the association between genomic mutation and gene, and also we basically, to account for multiple testing, we did a Benjamin Oakberg false discovery rate adjustment across all tests, and then we basically try to validate those results using a machine learning approach with Bayesian network. So, as I said, final analysis included 138 patients with the 74 gene panel results. Interestingly, genomic alterations were found in all cases, and with usual suspects, including TP53, AR gene alterations, PI3K, BRAF, EGFR, etc. The median number of pathogenic alterations was 2, and target alterations of interest were found and included DNA repair genes, BRCA2, BRCA1, CDK12, PI3K, PTEN. So what was interesting in these analyses, in our opinion, was actually that among all the genes that were found to have pathogenic genomic alterations, CDK12 was found to be strongly associated with African American in comparison to Caucasians, with 13.5% versus 0%. And this statistical difference was confirmed using the machine learning approach as well. So, so in this data set, the liquid biopsy was useful for genetic characterization, and is interesting to us. African American with prostate cancer were 29-fold more likely to harbor a pathogenic mutation in CDK12 compared with Caucasian men, which, to our understanding, was is one of the first times we have such a remarkable difference in the prevalence of CDK12 genomic alterations by race. So these differences have potential clinical implications, and they definitely support ongoing research on the clinical utility of non-invasive approaches for genotyping, such as a liquid biopsy, as Guardant in this case, and others out there, and potentially a therapeutic response monitoring with focus on African American population. So next steps for this work is actually we're having an ongoing collaboration among more academic sites, and we're going to be able to hopefully soon expand this cohort and identify whether or not these differences hold true in a much larger cohort that will include hundreds of African American patients with metastatic prostate cancer, and compare the genomic profiling of those individuals with Caucasians who also were tested and had prostate cancer in the advanced stage.